welcome folks. If you're just joining us, we're going to give people maybe 2 more minutes to get logged on. So please just hang tight. Uh-oh, someone told me they can hear my fan. All right, I'll turn my fan off. Sigh. All right, no fan for me. Welcome to those of you who just joined us. We're going to give maybe another minute or two for people to get logged on. So just hang tight for the time being. Alrighty, it looks like we sort of stabilized in terms of participant numbers, so I think I'll go ahead and get started. I, as always, would like to start by acknowledging that even though we're meeting via Zoom, that each of us is doing so on Indigenous lands. I am personally calling in from the traditional lands of the Suquamish people, and in Seattle, where many of us live and work, we recognize all of the Coast Salish people of this land, the Suquamish, Tulalip, Duwamish, and Muckleshoot nations. And we honor the people who are still here on whose lands we are guests. The webinar today is mainly going to focus on safe return to the office, but I do have a couple of announcements to make before we get to that topic. First, I'm super pleased to share with you that the School of Public Health just received notification that we have been reaccredited with the Council on Education for Public Health for another 7 years through 2028. So woohoo! Yay, everybody who worked so hard on that. For those who haven't been following the drama of our reaccreditation process, schools of public health are required to be reaccredited every 7 years. And we were first accredited back in 1970 when we were one of just a handful of schools of public health. And we have never had a lapse in our accreditation. So I'm really happy that we do not have one still. Many of you spent a lot of effort, time, and energy and hard work over the last 2 years to put forward our best possible foot for accreditation, helping with the self-study process, all the responses to SEAF, many iterations of coming up to their requirements and guidance. And so we're just thrilled with the outcome. We really met a huge percentage of the criteria. So we were able to get down to only 2 criteria that we still need to do a little bit of work on, but that's 96% of the criteria met, which is tremendous. So thank you all for all of your efforts, but particularly the efforts over the last couple of months just to try and winnow down that final list. Huge thanks in particular to the Self-Study Oversight Committee. We had over 130 faculty, nearly 60 staff, and almost 40 students, many of whom are now alumni, and 90 people who are alumni already, and a good number of external partners who were involved in the process. Special thanks go out to Kimberly Hay, who's the staff member who took the lead role on this entire process. We're hugely indebted to her. And also special thanks to both Carrie Farquhar and Shirley Beresford, who led from the Office of the Dean leadership team on this initiative. So I think that someone, probably Jashana, will put in the chat box the creditors report in case you want to check it out. So Again, thanks to everybody on this. The other news is that we launched our new 5-year strategic plan in July of 2020. And in April of this year, we did a survey to assess where SPH faculty, staff, and students felt that we were with the plan after the first year, to give us sort of a baseline towards completion. Huge thanks to everyone who completed the survey. And the feedback was really informative. And I wanted to let you know that the results from the survey are now shared on the strategic plan webpage, which also has marks to show you sort of where we are with each of the steps. And I believe Shoshana will also put the link to that page in the chat in case you want to go and check that out. So with that, we're going to turn over the discussion to back to work in person. And just to be clear, because in the document that we sent out, the Google Doc we sent out, there were some questions about classroom stuff. I'm mainly talking about workplace issues today as opposed to classroom situation. Our last webinar, we spent a lot of time talking about classroom issues, and I'm happy to revisit that at a future time, but this was really designed predominantly for staff and the people who supervise staff, for you to get a sense of what to expect in the coming months. So as a reminder of where we are today, with June 30th, today is the day that the state of Washington reopens, but we are still waiting for clarification on some issues from the state, not just from the governor's office and from Department of Health, but also from Labor and Industries. And then the University of Washington needs to make modifications to our own guidance. So as a result, we are still in under the same guidance that we have been for the last couple of months, which means the following, that for everybody, regardless of your vaccination status, you need to be wearing face coverings on site at the university if you're either indoors when other people are present and in all public and common areas, or if you're outdoors in an area where you are not able to keep a 6-foot distance. And there will be changes, and we'll talk about what those changes are going to be. But you should expect that they probably won't be rolled out until after the 4th of July holiday. We're anticipating probably sometime in the window of July 7th through 15th. So until you get formal notification that we have switched to new guidance, you need to continue wearing your face masks. Some of the other current requirements, which will continue at least for the short term, after the new guidance comes out, is that all employees are expected to complete the COVID-19 safety training module online before they come back to campus in person. And in addition, you need to review your unit's return to work on-site plan before returning to work on site. So this is both before and after new guidance comes out. In addition, we still have a situation, and expect that this will continue, at least in the short term, that employees need to submit symptom attestations through Workday for each day that they are on campus. And as always, individuals who are experiencing symptoms of COVID-19, regardless of your vaccination status, should not come to campus. So other things that sort of just to make sure everyone's on the same page in terms of like where we are, you hopefully haven't failed to notice that the University of Washington announced that we have vaccine requirements for students and employees. As we speak, the campus-wide work groups that are involved in the implementation planning for that are finalizing the details about how those requirements will be operationalized. And we're again expecting that the guidance about what you are expected to do, the details of that will be released shortly after the 4th of July holiday, again, sometime in the window of July 7th through 15th. In the meantime, Obviously, we encourage all students and employees who are able to get vaccinated as soon as possible. Other big shifts that we've seen in the last month are that the CDC released new, less restrictive workplace guidance. That really has been the prompt for, or one of the big prompts for why we're seeing shifts in our own state, local, and UW guidance as well. So let me tell you a little bit, summarize what that CDC New Workplace Guidance looks like. So first of all, why did they change their recommendations? One of the changes that took place in the last couple of months is that now vaccines for COVID-19 are available to pretty much all individuals in the United States over the age of 12 who wish to get vaccinated. So we're no longer in a shortage situation. In addition, the vaccines that have been received emergency use authorization in the United States, so Pfizer, Moderna, and Janssen vaccines have all been demonstrated to be safe and effective. And all three are through continuing studies have shown to provide excellent protection against severe disease, hospitalization, and death from current variants of COVID-19. We just have had results come out for both Pfizer and Moderna for Delta Gamma variants and are expecting data to be released shortly for Johnson & Johnson, but the preliminary data for those variants also looks good. In addition, the CDC noted that there's a growing body of evidence that fully vaccinated individuals are less likely to transmit COVID-19 to other people, even if they do become infected. So it's unlikely that they'll get infected, but even if they do, very much less likely that they are able to transmit to others because people who are vaccinated tend to have lower viral loads. So as a result of all of that, the CDC changed their guidance and said that it is not critical for fully vaccinated individuals who feel healthy to wear masks. So that was the basis for that change, and we're now seeing it rolled out at the state and local level. So the other big change that has occurred just in the last couple of weeks is that we in Seattle have hit the mark, and King County have hit the mark of having 70% of our eligible population being vaccinated, which means, so it's not only that if you're vaccinated, that you have good protection and you're less likely to transmit to other people, but also that because we have so many people vaccinated, we have we've seen really dramatic declines in the amount of circulating disease in our community, and also significant declines in hospitalization and death here locally. So we've been waiting somewhat impatiently for Governor Inslee and Labor and Industries to come out with more detailed guidance that explains what reopening means for workplaces. But the preliminary reports that have come out and the preliminary guidance that has come out suggests that what they are aiming for is something that is more aligned with that CDC guidance, i.e. that fully vaccinated people do not need to wear masks in the workplace. It's important to note that the University of Washington, as an institution of higher education, is also subject to separate sets of guidance besides just regular workplace guidance from L&I, which are the higher education safety guidance that the governor issued back in October of 2020. However, Governor Inslee released a proclamation yesterday that indicated that those institutions of higher education in Washington that have vaccine mandates, which we do, will be subject to fewer restrictions and won't be held to all of those requirements. So we still, as an institution, have some questions about what was in the proclamation, and how to operationalize the requirements that they have to be considered to have a vaccine mandate, because they weren't exactly aligned with what we had been planning. So we're hoping either to get clarification or even better, an updated proclamation either later today or tomorrow. But again, that's sort of the reason for why the plan is to roll out our own guidance after the 4th of July holiday. We're still, even though today is the day of reopening, we're still seeing details about what that means for us as a workplace and an institution of higher education, still seeing those sort of trickling out and trying to work hard to get our own internal guidance aligned with what the state is requiring. So what can we expect? Again, I would say expect starting sometime between July 7th and 15th that we will go live with our new requirements and the systems. And that until then, everyone needs to follow current masking and distancing requirements, regardless of your vaccine status. Another key area is that that hopefully all of you guys are aware of, but that bears repeating, is that Anamari and Mark Richards formally notified UW employees that those who are already teleworking and can continue to telework without impeding campus or unit operations are allowed to do so without any special approval from their supervisor through September 10th of this year. And that after September 10th, so starting September 11th, that employees who wish to telework on a regular basis need to have a written and approved telework agreement in place. We obviously were hoping that that most of these details around what's going on with the state would be sorted out by today. And so we're hoping that we too would be able to provide more detailed guidance about, for instance, telework within school public health. But since we're still working through some of these institutional and state level issues, we are now aiming for trying to get to all of you the SPH guidance for telework, probably sometime between July 15th and July 30th. And so that's really the window that you should be looking at to start having conversations with your supervisors about telework. That being said, what I do want to do today is to provide you with both what we think the workplace guidance will be for University of Washington, based on most recent information that we have as of this morning, and conversations with LNI and the state and the institution, and also what we're thinking about in terms of school of public health guidance. So first of all, let's talk about what we anticipate will be the case starting somewhere in that week of July 17th to 15th. So first of all, UW is planning to have a system in place via Workday for employees to declare their vaccination status. And employees will be required to provide vaccine status information using that method per the UW's vaccine requirement for employees. And so we anticipate that module will be rolled out again in that window of July 7th through 15th. And they're trying to synchronize rolling out that module with the expectation that people would be putting their information into the system. I wanted to reassure people who are concerned about privacy issues that the access to that information about vaccine status will be limited to the individual who put it in and their supervisor, and potentially a supervisor one level up. There are currently requirements from labor and industries for us to qualify as having a vaccine mandate for supervisors to have that information about who's vaccinated and follow through on that information in terms of safety issues, which we'll talk about in a second. So they do need access to that information, but other people will not have access to your vaccine status. The possible exception to that I've heard about is that it may be that information will be rolled up to the department administrator, the department chair within each department, so that they would have access to information for across the department. But that's still TBD. We also are fairly confident at this point that the University of Washington will implement, again, probably around July 7th through 15th, a new masking policy that's aligned with the new CDC guidance and anticipated state guidance that will be bifurcated based on vaccine status. So individuals who are fully vaccinated will not be expected to wear masks on campus, although they may do so if they choose to. And individuals who are not fully vaccinated will be expected to wear masks on campus indoors when other people are present and in all public and common areas. In indoor workplace settings, and this comes back to why your supervisor needs to know your vaccine status, the supervisor who has access to that information about your vaccine status will be, and this is sort of L&I language, will be responsible for ensuring that individuals who have not attested that they are fully vaccinated via Workday are wearing their masks as required per what the policy is. Again, we're awaiting more detailed guidance about expectations for supervisors and how they would handle non-compliance. That's part of this packet of information that should be forthcoming after the 4th of July holiday from Central HR and also EH&S at the UW. So to reiterate, no one other than the supervisor or potentially the department chair and department administrator as well will have access to the employee's vaccine status and Workday. And so those people also, if you are not the person, someone else's supervisor, you should not be asking individuals about their vaccine status or policing whether or not people are wearing masks. The intent is the supervisor in the workplace setting is sort of the compliance person, and otherwise in public areas that the university, what we anticipate at this point is that compliance will be on the honor system and that there will be signage indicating masking requirements in public places. And this is likely to be the same case for classrooms in the fall as well, i.e. that faculty would not know vaccine status for students in their classroom, and that students would be, who are not vaccinated, would be expected on the honor system to wear masks. Of course, there's a lot that's changing rapidly with conditions of the pandemic. So it's possible that some of these things could change between now and the beginning of fall quarter. We are currently hearing from L&I that there will be no physical distancing requirements in workplace settings now, but for the University of Washington, when we switch to the new implementation, which again, sometime between July 7th and 15th. That being said, so regardless of vaccination status, so there will not be the requirements in terms of either a 3 or 6 foot distancing requirement. We do expect that LNA will probably provide some more detailed recommendations that will not be required for unvaccinated persons of how they can increase their own personal safety. And that would likely include probably some physical distancing recommendations for those individuals, but it will not be for individuals who are fully vaccinated, for instance, to maintain distancing from people who are not. So again, there's not, within this new paradigm, there's not a reason why individuals need to know the vaccine status of other people unless they are supervising them. My understanding is at this point that once this new guidance is implemented across campus, units will not be allowed to impose more restrictive requirements. For instance, a department couldn't say, we as a department have decided that we're going to require everyone to wear masks in common areas, regardless of vaccine status. Or we in the OD couldn't say, like, in order to come into the OD suite, you have to wear a mask. And we expect that I expect that that will be true for classrooms as well, that individual instructors will not be allowed to unilaterally impose a masking requirement for all students in their course. Instead, there will be this honor system for students who are not vaccinated to wear masks. There are, of course, some individuals who are not able to become fully vaccinated for medical reasons, or who are still vulnerable to infection, even if they are vaccinated, for instance, because they're immunocompromised. So those individuals, the process for them is that if they feel that they cannot work safely under these new conditions, that they should submit a request for a formal workplace accommodation through the HR system. And hopefully Megan will put in the chat box, well, she put the link to the UW-HR webpage, Return to Work Resources, and I'm pretty sure on that page, but if not, she will paste where it is the link to how to get accommodations. And just to be clear, if there are any faculty who are on the call, that faculty who likewise fall into that category where they need an accommodation, that accommodation should be sought centrally and will be managed centrally. And then the department will be told what accommodations to make. So it's not something that you go to your individual supervisor or HR person in your department to navigate, although they are there, the HR folks in your department are there to help you figure out that process if necessary. Okay, so while we are still working on telework guidance for SPH, here's what I can tell you right now. And then we're going to switch over to check out the Q&A of what people have posted. And Shoshana is going to act as moderator and ask questions, including some that came through the Google Doc. So right now, what we're working on between the Office of the Dean and then the departments within the School of Public Health is to try and develop some standard telework scenarios for the school, as well as some guiding principles. And the reason that we're trying to develop these scenarios is to ensure that we as a school are able to do the following. So first of all, we need to be able to provide essential services to our students who will be predominantly back in classes on campus in person starting in the fall. We also want to make sure that we're able to go back to leveraging the significant strengths that we have when we're able to work collectively in teams in person. And we know that it is more challenging to work collectively in a hybrid situation. It's hard. The easiest is in person. Next easiest is if everyone's remote. The hardest is in this hybrid situation that we know we will find ourselves in. So we want to be able to get back to a place where we're at least able to, some parts of the week, leverage those strengths. At the same time, we want to be able to retain our fantastic staff who we know have grown to appreciate the advantages of teleworking during the pandemic. And it was really helpful to get the comments that all of you provided in that Google Doc about safe return to campus. I know some of you felt like you'd already provided those, but because things have been shifting so rapidly, it's helpful to know what people are thinking now and what their concerns are. Some of the concerns that we heard through that document were that we really need to work on making sure that we have some equitable standards for deciding who gets to telework and how much individuals get to telework across the school. And also, it didn't come out as much in the safe return to campus Google Doc, but something that I've heard a lot, for instance, from our student affairs staff is trying to figure out ways that we can ensure that those individuals who fall into the category of having significant sort of public facing responsibilities, that they're still able to, like student services, that those folks are still able to have some degree of flexibility or ability to telework after September 11th. So those are the reasons that we're working on developing these scenarios, which again, we're hoping to get out to you guys sometime between July 15th and the end of July. So given that, what can I tell you right now? So I do want to reinforce that there is a strong expectation that everyone, other than those who were teleworking 100% prior to COVID, or who require medical accommodations, for instance, because they're immunocompromised, that everyone except for those exceptions will be working on site at least 2 days a week starting September 11th. So what does that mean? It means you should start dipping your toes into the water and getting more comfortable with what your commute strategy will be and with working on site during the month of August. So for instance, by like trying out coming in once a week. So we are not doing any kind of mandating of when or how you should make that kind of dipping your toe in the water transition back, other than asking that you are ready by September 11th to be back here at least 2 days a week in person. So, so it's up to you to sort of figure out what you personally need, but we want to make sure that people are aware that they should be using August to help navigate that transition process. It also means that I know we have people who have either moved out of state or have moved pretty far away from campus and who hadn't been teleworking prior to COVID. And for those people, now is the time that you should start to connect with your supervisors and your HR manager in your unit, because in most circumstances, you will need to make arrangements to move back to the area so that you are ready to commence working in person a couple days a week at a minimum, starting September 11th. So the question I think that probably is on most people's minds is, how will I know how many days a week I have to be here? Because I keep saying at a minimum 2 days. And so that's what we're working at. Part of what we're working at with these scenarios is trying to provide more guidance to supervisors of how to determine which people fall into which categories. We are supposed to receive from Central UW some guidance about what job categories are eligible for telework. And we have not received that yet. So that's another thing that we're waiting on. So that will be one of the factors. Another really important factor will be the type of work that you do. And I think those of you who have sort of service-oriented job responsibilities, such as student services, like I said, we're trying to figure out a way that you can do some telework, but you should definitely anticipate that the majority of your days will be here on campus after September 11th. So that's another factor. And another one that the university has brought up repeatedly is, but I honestly have not heard any complaints about this within the school, but I guess it could be, there could be cases of it, that they asked supervisors to reflect on whether they felt like people have been able to successfully manage their work remotely during the pandemic. And so that's a criteria for being able to continue to telework. I would say a more important one and a more universal one for us within the school is whether or not there's sufficient redundancy in your unit for those activities where it is important for you to be here for in-person team activities. Whether your supervisor has enough flexibility to be able to stagger your desired days off with others with similar job descriptions so that we have adequate coverage on site. So with that, so those are sort of the factors that we're working on. And I would say with the promise that there will be more to come and that we are trying to come up with systems that are more clear cut and more equitable. So with that, I'm going to invite Jashana, Megan, and Uli to turn on their cameras. Jashana is going to be our moderator for asking me questions. She has both the questions that people had in the Safe Return to Campus document and also ones in the Q&A. And I'm going to let her be in the driver's seat and go with whatever question she wants to ask. So And
Well, thank
I'll loop
you.
in Megan and Uli when I need help.
Okay. Well, good afternoon, everyone. It seems the bulk of the questions have to do with returning to campus amid the uncertainty of whether or not we should have on masks, and why aren't we paying closer attention to the guidelines that's established by WHO that still requires masking. So Hillary, can you talk a little bit about that?
Yeah, absolutely. It's a really great question because you sort of look at like our two sort of motherships in terms of public health are the CDC and the WHO. And so why does the CDC have such different recommendations than the WHO, and why are we following CDC ones? So it's important to remember that the WHO is issuing guidance for the entire world and recommendations. The nations in the world are not in the same position that we are currently in terms of vaccinations and COVID circulation. So we are incredibly privileged in this country to have such good access to vaccines and to good vaccines. And also, we're very fortunate to have had good uptake here locally, but in, you know, relative to other countries, we've had good uptake in the United States. And so that means two things. One is that it's reasonable to expect that people who want to get vaccinated can get vaccinated. Also, that those who want to get vaccinated can get vaccinated with vaccines that are effective against the variants of concern. And also that the amount of circulating disease is relatively low. So if new variants are going to emerge, it's much more likely that they'll emerge in countries where there's fewer people vaccinated and there's much more COVID circulating. So those are all the reasons. It totally makes sense that WHO is recommending that people who are vaccinated remain masked. And I would say if you are traveling to other regions of the world where there are not a lot of people vaccinated, for sure, and where there's a lot of variants emerging, please do wear masks when you are out in public, when you're around other people. That totally makes sense. We are just in a very privileged position here right now. And I guess it's important to remember too, it could change. So it could be that there could be a new variant that emerges, you know, at some point in the fall or the winter that the vaccines don't provide as good a coverage for, particularly in terms of severe disease, hospitalization, and death. And we have much better surveillance systems in place. I think it's more likely that that will be identified outside of the United States first, and we will have time to either roll back some recommendations about masking or distancing, and also to get out boosters that provide greater coverage for those variants if they do emerge. So yeah, so that's a great question though, a really good one.
Thank you. There also is a question on the Google Doc about event planning for fall events, and they're looking for some guidance.
Yeah. Yeah, so I've heard a lot of frustrations, both not just from the Google Doc, but from individuals as well, who are like, we need help. We're trying to get stuff organized. And the unfortunate reality is that like a lot of the other guidance issues from LNI and the state, we're still trying to get clarification on some of those issues. And some of it will have to do with whether or not we meet the criteria for being a fully vaccinated institution of higher education. So we're hoping that we will get that guidance figured out for the university again in that window of July, and released in that window of July 7th through 12th, but it's possible it could lag a little later than the other guidance. It's just a little bit more complicated, and it's been harder to get preliminary answers to it. So
Okay.
yeah, so I would say I hear you folks, and the reality is like you're probably just gonna have to wait until August to start really making concrete plans for events in the fall, and that's unfortunate, but better than waiting until September. I don't know. I'm trying to think of a glass half full thing here.
Yeah.
Yeah.
I know this call is primarily to talk to staff about the return to the workplace, but there is a question in the Q&A about whether or not the telework requirements will be applied to faculty, and if so, how?
So faculty are not subject to those telework requirements, because as a rule, faculty, and I know this is a source of tension between staff and faculty always, but faculty just have a lot more discretion over their own work schedules and work sites. That being said, the provost released reminders this week, reminding faculty that faculty are expected to be on on campus, even when they are not formally teaching, and when they so that they are available to mentor students, to serve on committees, to do all the other kinds of work that people do. So there's a strong expectation that faculty will be also physically present at least several days a week on campus starting in the fall, and an absolute expectation, unless faculty have a medical accommodation, that they will be teaching their classes in person starting in the fall quarter.
Okay. And does the requirement for 2 days a week on campus apply to part-time employees?
Yeah, so thanks for asking about that. I'm actually referring to full-time employees. We have not gotten down to the nitty-gritty of what there's so many variants when it comes to people working part-time. I'm not even sure that we get to that, but I was referring to full-time employees.
Okay. And then this is an interesting question because I kind of thought of it myself. Why is September 11th the date? And then this person wrote, the Northgate Light Rail link opens October 2nd.
Yeah, so I was not part of the deciding group for September 11th. I would not have chosen a day with such significance for our country if I had been part of that group. But my understanding is that the idea is to we do need people to be back and operate, and for us to have physical on-site operations present when our students are going through orientation and starting classes. So my sense was that it was a date that was selected to ensure that people have a little bit of time to sort of get used to that new work schedule before students start arriving. But other than that, I have no idea why they chose that particular date.
Okay. Will there be a blanket approach to masking for visitors to UW campus?
Yeah, so the blanket approach to masking, my understanding is it will be what the state is requiring and what the CDC requires, which is that if you are fully vaccinated, you are not expected to mask. If you are not fully vaccinated, you are expected to mask. But that it will be there will be lots of signage to that effect, but that it will be an honor system, because we have no way there won't be any vaccine police out there checking cards or anything like that.
Mm-hmm. And that goes to a question, will self-declaration of vaccination status and workday be verified somehow, or is it all on the honor system?
Yeah, that's a great question. So that is actually one of the sticking points that we have with the proclamation that the governor issued yesterday. We UW at large had been assuming that we did not have to do any kind of verification of the vaccine status, so effectively that it was on an honor system from place. And that's really important because, as many of you know, we all just got these little cards. And some people didn't even get those. Some people told me stories of just getting handed a card and told to fill it out. But those cards are really easy to fake. And we just didn't really have the systems in place to have a good verifiable system, not just in our state, but across the United States. So it's a pretty, although it seems like a great idea to have required verification, it's just practically pretty darn near impossible. So we had been assuming we would not have to do that, but the governor's proclamation made it sound like we would have to verify. So that's one of the things that we're trying to get clarification on from his office.
Okay. In reading the questions from the Google Doc, there is a lot of angst around who gets to set the teleworking arrangements, whether it's the supervisors have the last say whether or not you can telework. Will there be some sort of guidance that allows equitable application of the telework policy that the school determines to be, you know, whether it's 3 days in the office or 2 days, and everybody in a certain job class gets to do this, regardless of what the supervisor might want to have happen?
So I think it'll be somewhere between those two. So in reality, by university policy, it is actually the supervisor's decision in consultation with the employee whether or not to approve the telework agreement or telework request from the employee. That being said, what we're trying to do with these scenarios is to provide some decision criteria that that makes it clear both for supervisors and for employees which options would be open to specific individuals and which ones would not. I think that, you know, like in my conversations with the department chairs and administrators, for instance, I'm hearing a lot of this, like some want 3+2 and some want 2+3, whether the 3 is in person or the 3 is remote as an option. And we'll probably have both. And some of the decision about which one someone falls into may have to do with not just the preference, obviously the preferences of the individual, but also the kind of workspace that's available for different individuals and how, you know, so I think there's going to be a lot of differences there. What we're trying to do at least is make sure that it's not that we have some people in the same job categories where one person's 100% telework and the other person's 0% telework, when both of them would like to be doing some telework. So we're trying to narrow the gap, but I don't think we'll land in a place where it's like everyone who's in this job is 3+2 or 4+1. But at least we'll get closer to something that looks more equitable and where people understand the reasons for the decisions.
Okay. Here's a question that will the UW be providing PPE and cleaning supplies for faculty and staff?
Yeah, so Uli informs me that he has bazillions, or maybe it was 500 extra masks still. So we have masks, but Uli?
1,000 extra masks.
What'd you say?
1,000 extra.
1,000. Okay, I was order of magnitude. I was close. So, you know, between 500 and a bazillion. He has 1,000 extra masks. So we do have masks for people, the good masks, right? Really like the cloth ones, more the cloth ones. And so we had those available. I think what we're going to see is, and I suspect that we will have disposable masks that are available for visitors who are not vaccinated, because otherwise it would be hard to get people to do that if they're walking in off the street. In terms of cleaning supplies, one of the things that we're as a campus working on right now is ramping back up our janitorial services, because we've had limited occupancy in most of our buildings. And so we haven't needed full services. And that's been one way that the university's been able to cut down on costs to compensate for other increased costs from the pandemic. So those will get ramped back up as people start coming back onto campus. And so we need to inform the building management folks about how many people we anticipate being present at certain times, and to plan for that. In terms of the more intensive COVID cleaning that we were doing, for instance, right at the beginning of the pandemic, there's new CDC guidance, and that's now being reflected in state, local, and UW guidance, and I think has already gone through, that based upon studies that show that COVID is not transmitted via surfaces for the most part. So it's not like flu in that regard. And so that kind of really in-depth cleaning of surfaces is not something that's critical to people's safety in terms of COVID. So I think people should not expect that to be the case, but things like having hand sanitizer and disposable masks for visitors, I would expect those to be in place.
Okay. One of the Google questions is wondering how the plan to return to campus aligns with public transportation.
Yeah, so I don't know if people read the Seattle Times or not, but Seattle Times today reported that July 1st is the target for bringing back public transportation up to full capacity levels. And we had previously certainly received confirmation from the public transit authorities to the university that would all be back in place, ramp back up over the summer and ready for people returning to work. So that we're very confident about. I understand that people continue to be anxious about riding public transportation. And I want to reinforce that will continue to be, at least in the short term, even with reopening, mandatory mask wearing for all people, regardless of vaccine status, on public transportation in the state of Washington. Certainly, even if you're vaccinated, that is one of those situations. So similarly, like clinical environments, those are situations where we do not only recommend, but people are required to wear masks regardless of their vaccine status. So keep your mask with you. And really from a public health perspective, if you are fully vaccinated and you are masked, it's not that there's no risk on riding public transportation, but the guidance for allowing for increased levels of ridership there is based upon the fact that people who are vaccinated, and particularly vaccinated and masks, have really good protection against COVID, particularly for severe disease, hospitalization, and death. So, but nonetheless, I know people are still anxious about it. And some of that anxiety has nothing to do with sort of like public health people telling you it's okay now. It has to do with the fact that we've spent the last 15 months telling you don't do those kind of things. And so it's going to take a while for people to build up their comfort level with being in crowds and being out in public. And so I guess this is part of why I would encourage folks to, try and dip your toe in the water during August and test these things out and sort of build back up your comfort level so that, when we get to September, that you're not sort of like hitting a wall of like having to do this really abrupt transition.
I'm glad you mentioned about dipping your toe in the month of August, because one of the questions is, when can people start coming back to campus?
Yeah, so
cold turkey.
Yeah, so basically, and Uli, correct me if I'm wrong, but I think after the new guidance is released, part of that new guidance includes transitioning to, there will still be requirements for units to have COVID safety plans, but they're going to be greatly abbreviated from what they are right now. And so the university will also be pushing out these new templates for the new safety plans for the units. So us getting those new safety plans in place, and also us switching to these new requirements and not having distancing requirements, to me, are sort of the two barriers to allowing people to come back whenever they want to. So I would say sometime in the latter half of, so mid to late July, hopefully those things will be worked out, and people should have flexibility that if they want to come back, that we would love to have them back.
I think Uli's saying yes.
Oh, I need to say it, yes.
Okay, thanks.
Hillary, we just have a few more minutes, but I did want to go back to something you said in your introduction as to why is it important to come together to be back on campus if we can. One question said, the push to revert to a close to 100% as possible in-person normal coming from UW leadership seems out of touch with the fact that things have changed now for employees.
Yeah, I think that that's a really valid question. And, for anyone who's reading the popular press, every different sector of employment, people are asking the same questions. And I think the reality is, at least for us, we're having within our leadership team in the School of Public Health, and I'm seeing similar conversations in the other health science schools and other units on campus as well, that probably the future doesn't look like what it looked like before COVID. What we've seen is people's comfort with having people that they supervise being teleworking, people's ability to be self-directed and get their work done remotely has changed dramatically. And people have appreciated the flexibility of and the benefits of not having to commute in every day. So I don't know that we're going to return to, I don't expect, certainly not for fall, that we're going to return to this 100% in person. And I don't think people should interpret that as being the answer. We're really looking at trying to come up with some hybrid scenarios for those people who want to continue doing some telework. That we are going to do as a trial pilot program for the fall and see how it works. We have a lot to figure out as an organization about how to make hybrid meetings work and how to deal with working in teams where some people are present and some people are remote, and the best way to handle that. So I think we'll reassess sort of towards the end of fall quarter and figure out like if we want to continue on that path or we need other types of things. But I don't think people should expect it like we're just going back to the way we were. We aren't. However, we are going back to having students who are taking classes in person, and we are going back to being a work environment that where teamwork, a lot of the essential teamwork that we do and the creative teamwork that we do is facilitated by having people being able to gather in person, and all the benefits that come along with that. So I would say instead people should think of it as certainly for fall, a transition to being some days in person on campus and us having a better sense of who's here on which days and some equitable distribution of which people are here on which days, depending upon their job characteristics. Unless you happen to be like, so, the example I always give, even though I don't think there's anyone in our school who falls in this category, but like if you were the manager of a BSL-3 lab, you have to be in person every day. Like that's not a remote task, but those people know who they are. They've been working here full-time in person during the pandemic already. So other than them, we're trying to really figure out a way to make this a good workplace environment for everyone going forward, and to let you take advantage of the advantages that you've seen during the pandemic of being able to work at home while still reaping the benefits of having a really good creative community that likes working together. So that's what we're aiming for.
Great. So I think we're at the 3:59 moment. So if you want to close us out, for those whose questions we didn't get to answer in real time, I think there will be a document that's linked to this recording that perhaps we can get some answers included in that.
Yeah, a lot of this, unfortunately, we were hoping to have more definitive answers for a lot of things now, and it's clear that like some of that stuff is still in the works. So I would, what we're asking is people to continue to be patient. We're working on getting stuff resolved at the campus level, and then, filtering that down to some good guidance for us locally. But we are working towards that. We are listening to you, and we're looking forward to seeing people back in person.
Great. Thank you.
Thanks. Thanks, Megan and Uli. Thanks,